All right, so you're going to undergo surgery for your chronic ankle instability. Now, any patient who undergoes an ankle sprain, for me and really from a literature standpoint, should undergo some period of physical therapy because statistically speaking, about 80% of people don't require any surgical intervention. If you're a candidate for surgery, it means you failed some form of physical therapy, immobilization, maybe even some other treatment such as PRP injections, shock wave, or some chiropractic adjustments. So now you're looking at surgery. And so just to give you an example, ankle instability is an issue where the ligaments on the outside fail, resulting in an abnormal contact in the ankle joint. Now, why is that an issue? That's an issue because it changes the contact pressure in the ankle joint. If the ankle functions like this, the wear and tear on the joint is nice and symmetric. When the ankle is functioning inverted or inward, there's more contact on the inner portion of the ankle, and that can increase the chances of arthritis. And really, ankle arthritis is difficult to treat, and so we advocate the restoration of the ankle ligaments in order to allow for congruency or even wear on the joint itself. So, what are you going to need to know before you head into surgery? Now, first of all, anyone who has surgery, this type of surgery requires general anesthesia. You have to make sure you're healthy enough, so we have you get preoperative clearance, we have you get lab work to make sure you're healthy enough to undergo surgery. Any patient who's going to undergo this is going to be immobilized for a period of time. So you want to make sure that you don't put yourself at risk for having a blood clot. Make sure you move your knee. Make sure if you experience any calf pain, you call us urgently or go to the hospital urgently, because a blood clot can travel up to your lungs and cause an issue. And really, that's with any prolonged immobilization. So you want to make sure that we talk about and discuss, really, are you at risk and what signs you can be on the lookout for. When it comes to surgery day, typically, I'll do two types of lateral ankle stabilizations. I'll either do an open approach or an arthroscopic approach. The arthroscopic approach is typically performed in patients who have only ligament injuries. We're not talking about any tendon injuries or any tendons that need to be repaired. With the arthroscopic approach, there's a quicker recovery. There's not a big incision. I'm able to put anchors into the fibula directly through a scope. I'm able to look at the joint, assess any cartilage damage, and move forward with the arthroscopy lateral ankle ligament repair immediately after. So we'll talk about that recovery first. If you have an arthroscopic lateral ankle stabilization, typically after surgery, you'll wake up and be in a splint. Your splint will be at 90 degrees. It'll be hard on the back, soft around the sides. It'll allow for some swelling. After that, you're going to have to go ahead and keep your foot nice and clean and dry until I see you at about 2 weeks out. At 2 weeks out, you'll start physical therapy. I'll transition you from being in a boot, transition you from being in a splint to being in a boot so that you can move your ankle up and down. Most people can switch to an ankle brace after an arthroscopic procedure at about 6 to 8 weeks. The recovery is quick. I'm really happy and secure with the type of fixation I'm able to get, so I really allow patients to start doing some static, standing, balancing, range of motion, and really progress their physical therapy at around the 4 to 6 week mark. Typically, most patients can return to sport at about 10 weeks, even as early as 8 weeks, depending on the patient. I would bank on 10 weeks before you're returning to any running, jumping, or jogging. Certainly at about 6 to 8 weeks, doing elliptical, biking, or any light treadmill walking is okay. Physical therapy is the most important thing after surgery. We want to make sure your motion is good, especially now that you've got nice, stable ankle ligaments. That's the recovery with the arthroscopic brostrom. Typically, after surgery, I'll show patients pictures. They'll be able to see their cartilage. If there are any injuries to the cartilage, they'll be addressed at the time of surgery. The second type of procedure is open procedure. This has a little bit longer of a recovery because now we need skin to heal. Patients will still wake up the same way with a splint on the backside and a soft padding around the outside. They'll have to keep their entire leg clean and dry until I see them back at 2 weeks. At that point in time, their incision will be cleaned and the sutures will be removed. These patients, for me, still start physical therapy at 2 weeks, but I allow that physical therapy to extend along a longer period of time because of the open incision, and typically this is associated with patients with more pathology. There's more peroneal tendon injuries. Potentially I'm going in and addressing any osteochondral or cartilage injuries, and so those patients may have to be off their foot for anywhere between 3 and 4 weeks depending on their injury. All in all, you'll still start physical therapy, but a return to sport with a cartilage injury or any type of secondary reconstruction may be extended until about 2 months out. So you have a little bit longer of a recovery from a dynamic standpoint, and return to sport will usually be around 3 months out. Return to dynamic physical therapy usually at the 2-month mark. So if you have an open procedure, you have to be in a boot for at least a period of 8 weeks. At that point in time, you can transition into an ankle brace and usually, again, return to sport about 3 months. If you have any questions, let us know. Anyways, happy recovery. Peace.